our guest, my friend Tete Antonio, Minister for Foreign Affairs, who is representing my brother, the President of Angola, who is in Kenya as we talk. And he will be having a state visit tomorrow. Fellow leaders, the great people of Kericho, distinguished Kenyans, members of the diplomatic corps, guests, ladies and gentlemen, watu wa Kericho, hamjambo tena. Kericho hamjambo. Kericho chamge. Omune. Kericho, Bwana Yesu asifiwe. Hebu mnisalimie hewani nione hivi watu wa Kericho. Asanteni sana. Mashujaa Day is a celebration of the power of individuals to change the course of history and the destiny of a nation. It is a reminder that nations are driven forward and changed by individuals, ordinary men and women who believe they can make a difference and who believe they can change the status quo. The status quo in 1963 was a colonial state, the denial of basic freedoms and dignity. Deep inside many individuals then, they believed change was necessary and they took action. Individuals' belief resulted in action and ultimate progress that made us the people we are today, an independent, democratic, progressive nation. Today, the status quo is a hunger for socio-economic transformation, one that most of us feel is long overdue, and we are rightfully so. The need for heroism is as urgent as it was in pre-independence Kenya. The power of individual action is still as powerful today as it was then. Our heroes today are on the farms, the markets, in factories, in offices, in construction sites, and in many other places. Our heroes are using their creativity to create content and shape culture. They are playing on fields, running on tracks, and working across many other fields. Every day, when we do our best, when we deploy our diligence, intellect, passion, creativity, hard work, and the sense of purpose, every day that we believe we can make a difference, we are changing our country. This is our call to Mashujaa, to the best of us, to be the best of us every day, and to move our nation forward. This is why we are focused on empowering Kenyans to be at their best on diverse fields by democratizing and innovating government services to ensure that we give as many Kenyans as possible the opportunity to be their best so that they can move our country, our nation forward into a destiny that we all share as a people. The Constitution guarantees Kenyans the right to the highest standards of health. Since independence, successive governments have made efforts in guaranteeing access to quality and affordable health care for Kenyans, but with limited success. there have been several attempts and efforts to achieve universal health coverage. One in 2003, in 2013, and in 2018. However, these efforts were met with little success. It is for this reason that the government of Kenya identified healthcare delivery as one of the core pillars of the bottom-up economic transformation agenda. In the Kenya Kwanza Manifesto, we made several commitments towards the delivery of universal health coverage. These include the provision of a fully public financed primary health care, the installation of a digital health management information system, and the setting up of a fund for improving healthcare facilities across Kenya. Other commitments were the setting up of an emergency medical treatment fund, the establishment of a national insurance fund that covers all Kenyans, and the availability of medical staff who deliver on this great universal health coverage that has been in the works for a long time. The government has instituted a paradigm shift to preventive and promotive health rather than where we've been at curative health. This approach also makes economic sense. Community health reports state that for every 1 shilling invested in community health, 9 shillings and 40 cents are realized in economic and social gains in our society. In our plan, delivery of primary health services at community level will start with community health promoters, and we are very proud that they are represented in large numbers today in this very important Mashujaa Day. The work of the promoters will include basic preventive and promotive health, health education, basic first aid for the treatment of minor injuries and ailments at household level, and referral for facility-based health care. Each community health promoter is allocated 100 homes within their neighborhoods, and this will happen countrywide. Considering the pivotal role played by community health in attainment of universal health coverage, the long-term financial viability and sustainability of community health is contingent on enhanced domestic resources for health. The national government is working closely with our county governments to strengthen the delivery of community health services through the payment of stipends for the 100,000 community health promoters. This will be done on a matching basis, 50% contributed by the national government and 50% contributed by the county governments. The national government has already allocated Kenya shillings 3 billion annually for payment of these stipends, and it is my belief that counties will match up this fund so that we can enable these great heroes of our time to help us on the delivery of community health at the household level. It is worth noting that as of today, over 1 million households in 10 counties have been visited already by community health promoters, overt services, and their data captured in the Afya Nyumbani dashboard. And this is a significant major achievement, as this dashboard is not only available to the Ministry of Health, it is also available in my office. We also agreed to provide the 100,000 community health promoters with kits, which contain basic equipment for household health screening, medicines and supplies used for service provision at the household level. And as you can see today, every community health promoter here present, each one of them has a health promoter's kit. And that is the case with 100,000 community promoters everywhere in the Republic of Kenya. Quality community health data is essential for the planning, resource allocation, and monitoring of progress towards universal health coverage. The government is committed to delivering on the digital health agenda, starting from the community level. The electronic community health information system, which is live and being used by the promoters across the country, is a simple and user-friendly mobile health device being used, and its application will be used to collect real-time, accurate household data. It will also initiate planning for health service delivery and provide linkage to health facilities. Along the CHP kit, the government has provided additionally 110,000 smartphones for use by the promoters and community health assistants. The shift from curative to preventive health will further be strengthened by the promotive services provided by community health promoters at the household units and integration of preventive services at the primary health care level. These services will include screening for hypertension, diabetes, and high conditions, offer the necessary health education on water and sanitation, nutrition, and provide community rehabilitation services, among others. These services will be provided through multidisciplinary teams that will be established at the level of the primary care networks. To strengthen the legal basis for health financing, health service provision, and achievement of UHC, 4 new health laws, which I signed into law yesterday, have been enacted. These are the Community Health Insurance Act 2023, Primary Health Care Act 2023, Facility Improvement Act 2023, and Digital Health Act 2023. Health insurance coverage in Kenya is generally low at about 26%, with those at the bottom of the economic pyramid having the least coverage at only 5%. Many Kenyans incur catastrophic expenditure from out-of-pocket healthcare payments, while many more do not seek care at all when they fall ill because they simply cannot afford it. Over the last decade, several measures have been put in place to enhance the capacity of the National Hospital Insurance Fund to effectively deliver on its mandate. While these reforms and the initiatives therein have yielded significant progress, several gains and several gaps remain. Recent analysis show that, among others, the NHIF operates as a passive rather than a strategic purchaser of healthcare. It is plagued by inefficiency and governance challenges and is potentially unless addressed, financially unsustainable. It is against this backdrop that the government proposes a paradigm shift in the provision of social health insurance in the new Social Health Insurance Act 2023 that provides for formation of a social health authority which will repeal the current National Hospital Insurance Fund Act 1998. In our plan, I promise a fully publicly financed primary health care system, an emergency care fund, and a health insurance fund that will cover all Kenyans. This promise is delivered through the enactment of the new Social Health Insurance Act, which among others establishes the publicly financed primary health care fund, a fully publicly financed chronic and emergency and critical illness fund, and the social health insurance fund, and access to health care from now henceforth will no longer be based on ability to pay. It will be based on the health needs of every Kenyan. We are implementing a per household payment system where a flat rate applies to everyone regardless of their income. Consider this, for example. Previously, an individual earning 10,000 had to pay Kenya shillings 500 for NHIF, a hefty 5% of their earnings. On the other hand, those with a salary of 100,000 or more contributed 1,700, a mere 1.7% of their income. Astonishingly, even someone with monthly income of Kenya shillings 1 million, like William Ruto, the president, paid the same amount of 1,700, which translates to a paltry 0.17% of their substantial earnings. This bizarre setup meant that low-income earners, mamambogas, and bodabodas were effectively subsidizing high-income earners like myself. The Social Insurance Fund corrects this anomaly and makes sure that every citizen pays for health a percentage of their income, an equal percentage of their income, so that we can equalize the fortunes of every citizen with respect to access to health. The Social Health Insurance Fund also signifies a shift to increased use of domestic resources for health financing and a sustainable approach, especially at a time when resources from donors and development partners are dwindling. The healthcare system in Kenya is largely focused on curative services at the expense of preventive and promotive services. This has occasioned inequity in financing, which has disadvantaged primary healthcare uptake and promotion. The government's mission is to build a progressive, responsive, and sustainable healthcare system for accelerated attainment of the highest standard of health for all Kenyans. The funds allocated to public health facilities have substantially reduced over the years, as they are directed to the county revenue fund and are rarely reinvested into the facilities. The lack of autonomy in public health facility management and financial control has led to increasing fragmentation, poor service delivery, deteriorating health outcomes, reduced efficiency, access, equity, financial risk protection, and also insignificant transparency and accountability. The Facility Improvement Financing Act corrects this situation and aims to structure the process and guide the counties on how to provide for retention, management, and use of revenue derived from health-related services rendered at public health facilities. The Act seeks to ensure a unified approach for health facility finance and management autonomy, where public health facilities are able to retain their funds and have autonomy to operate their facilities based on their priorities. This will improve availability of resources at the facility to provide adequate and equitable quality health services, increase efficiency, and thus improve health outcomes for all Kenyans. Kenya has made significant strides towards digital transformation, with many sectors leveraging on technology to enhance implementation of digital products and services. The health sector has made steady progress in digital technology transformation through implementation of digital solutions to manage and share and use data. However, the adoption of technology has been uncoordinated and characterized by fragmented implementation, with health sector actors not adhering to basic digital health standards, guidelines, recommendations, and digital development principles. These technologies have affected how health data is managed, resulting in multiple systems that have limited ability to exchange data. The Kenya Kwanza Manifesto identifies digitization as a pillar for the health sector to achieve universal health coverage. Accordingly, the Digital Health Act provides the legal basis for the development of a comprehensive and integrated health information system. These systems will enable end-to-end visibility of health processes and seamless sharing and portability of information that will enhance health service delivery and improve efficient use of resources. The enactment and implementation of the Act and the digitization agenda will deliver on the promise to integrate ICT to enhance telemedicine and health management information systems. Apart from the 4 laws, the Ministry of Health has put in place various policies and strategies to actualize strengthening of local manufacturing of health products and technologies, to have at least 50% of medicines on the Kenya Essential Medical List produced locally, ensuring procurement mechanisms guarantee value for money and provide advantage of economies of scale. Our mission is clear: to build a healthcare sector that is a shining example to the world, with healthcare workers in the right numbers who are motivated, well supported, and inspired to deliver their best. Together, we will ensure that every Kenyan has access to quality health services when they need it, regardless of their background or financial circumstances. I acknowledge the Ministry of Health, Safaricom, the World Health Organization, UNICEF, UN Program on HIV/AIDS, and United Nations Population Fund, the Danish International Development Agency, the United States government, the World Bank, Children Investment Fund Foundation, Academic Model Providing Access to Healthcare, Medic Mobile, US President's Emergency for AIDS Relief, and AMREF Kenya, among others, for their immense support. I request that we clap for this great partners of our healthcare delivery system. Kenyans have deliberately rejected ideas and programs that limit our productivity, waste our resources, and delay our takeoff. This is why our focus on effectively lowering the cost of living is based on increased agricultural productivity and expanding land and other resources for production. We have rolled out an agricultural support program that has provided farmers with access to fertilizer, affordable credit, and extension services. By end of July, we had distributed 3.5 million bags of region-specific crop fertilizers in 41 counties to registered farmers, working with county governments for last-mile delivery. For the first time in Kenya, fertilizer was distributed on the basis of acreage and the crops that farmers produce via a digital e-voucher platform. The results of this program are evident across Kenya. We have placed over 200,000 acres under cultivation, which is more than last year. We are looking forward to a bountiful 44 million bags from the long rain season and 61 million bags overall for both seasons, marking an impressive increase of over 40% in relation to last year. Fertilizer support for the short range crop is now available at National Cereals and Produce Board depots for regions that planned in this season, including central Kenya, eastern and western parts of the country. I urge all unregistered farmers to use this opportunity to register so that they can benefit from the support of fertilizer for all their crops, whether it is tea, coffee, sugarcane, macadamia, avocados, and all the other crops that are engaged with our farmers. To reduce our national edible oil import bill, which currently stands at $1 billion annually, the government is supporting sunflower cultivation by distributing 600 metric tons of seed to farmers in partnership with counties in eastern, western Nyanza regions during these short rains. It is important that we are working with counties on other oil crops to deliberately reduce our import bill on oil and edible oil requirements for our country. When we came into office in September last year, only 320 government services were available online. Today, there are more than 13,000 services, and we expect to onboard all services by the end of this year. This has increased efficiency. This has increased efficiency in service delivery, revenue collection, and enhanced accountability of government services and revenues. The government is currently rolling out the last mile 100-kilometer of fiber optic infrastructure throughout the country to improve health facilities, improve schools, judiciary offices in far-flung areas, and other public institutions. We are also concurrently setting up 25,000 Wi-Fi hotspots targeting fresh produce markets, bus parks, and other public spaces. We are also working with members of parliament in the setup of 1,450 ICT hubs in every ward in Kenya. And I am happy that the National Assembly has aligned the national government Constituency Development Fund Act to actualize this strategic intent. Our goal is to spur e-commerce, the creative arts, and the digital economy, the frontier of our bottom-up economic transformation agenda. We continue to make significant progress in our education sector. Immediately after assuming office last year, we ended months of uncertainty by resolving that junior schools be domiciled in our primary school setup. We have reduced the teacher shortage by hiring more teachers. In the last 1 year, the Teacher Service Commission has recruited 56,000 teachers, which is half of the required number or half of the shortage that we have. This is the highest recruitment in the history of the Commission in 1 year and the largest such exercise in Kenya's history. We intend to close the gap on teacher shortage in the coming 2 years. Further, in keeping with government's policy to equip Kenyan youth with practical skills and competencies, we are working with our TVETs to ensure that another 2,000 TVET college tutors are hired to support our TVET education that has increased from 90,000 8 years ago to 350,000 currently. I am also happy to note that we have concluded with the government of China the supply of equipment for another 70 technical training colleges in Kenya that will ensure that more young people have access to gadgets and tools that will improve their acquisition of knowledge and skills to be able to be job ready as we march forward into the future. In a transformative shift, we unveiled a new funding model for higher education and technical and vocational training that guarantees needy students free college studies. The funding comprises government scholarship, government loans and bursaries, and household support. Through this model, we have raised the funding per student by 40%, and we have now eliminated the tragic situation of many of our universities that were steeped in huge debts because of underfunding that had become the norm. Housing is a revolutionary agenda that will have an extensive impact across the economy. At scale, the affordable housing program will create jobs for our young people, expand the manufacturing of construction products and materials, and enhance economic activity across many sectors. The construction of 46,792 units is already underway, and another 40,000 units are ready to commence construction in the next few days. Architects, engineers, quantity surveyors, masons, electricians, plumbers, transporters, steel factory workers, cement factory workers, and hardware merchants will be engaged in this transformative construction housing enterprise to construct 200,000 housing units annually. The construction of one unit, for the record, creates between 3 and 5 jobs directly and 5 to 8 jobs indirectly. More jobs will be created with the formalization of the Jua Kali clusters that will provide products such as doors, windows, and hinges for this program. I stand before the people of Kenya to express my pride and admiration for all Kenyans who have risen up to the challenge of the moment, seized opportunities that came up as we deliver our commitments and implemented the bottom-up economic transformation agenda. This enterprising ethos, the hustling spirit, and the motivation to do your part in making this country move forward is all, and it is heroic. Therefore, let us dedicate ourselves to nation-building endeavors, assured that as long as we are implementing the bottom-up economic transformation agenda, your government stands with you and will walk the road of